Hello, everyone. This is Naveed Tariq, co-founder of TukTuk.ca. TukTuk.ca is a virtual platform where you can find your personal, family, home, and office needs. You can find service providers, for example, plumber, electrician, immigration consultant, a roofer, physiotherapist, tutor, all your personal home, family, and office needs. Today we have another industry expert from Mr. Gowtham, Pidaparthi. He is a physiotherapist and he has a lot of experience from the industry. Let me welcome Gowtham. Gowtham, can you please give us your brief introduction?
Thanks, Naveed. Myself, Gowtham Pidaparthi. I'm a physiotherapist for the past 20 years. I'm from Oshawa, Ontario, and we have clinics both in Oshawa and Courtice, and our firm name is Advanced Physiotherapy. And we've been in practice for the past 6 years, and I'm working as a physiotherapist for the past 20 years. And I'm also an immigration consultant myself for the past 6 years. Helped several physiotherapists who came from different parts of the world, India, Pakistan, Bangladesh, Philippines, you name it, like a lot of countries, they immigrate here and they're trying to get their license. So I help them, mentor them and train them to get their license in Canada. I also, I'm a investor as well. I try and open clinics, chain of clinics, and I give opportunities for physiotherapists to come and work here. I'm also myself very enthusiastic physio. I've done over 30 courses in the last 10 years, to name a few. So those are my achievements so far. And we conducted exams for over 500 physiotherapists to get trained and get their license in Canada.
Wow, wow. So we have an all-rounder, like we in cricket, we say it's an all-rounder. He is a physiotherapist, he is an investor, he's an immigration consultant, so many fields, a lot of experience. Gowtham, definitely we are going to learn from you. Let's start, Gowtham, with my first question. Please tell our viewers, what is physiotherapy and when a person should go to chiropractor or physiotherapist, because people sometimes they ask this question, they're not sure where to go.
Right. That's a good question. So physiotherapy is actually a field where we use physical agents like light, sound, heat, hydrotherapy, different physical modalities. So say we have ultrasound, which is use of sound. We have laser, which is use of light. We have hydrocollateral packs, which is use of heat. We have electric currents that we use, like different kinds of physical modalities to help with people's aches and pains. But the primary thing that we use also is movement in the sense in the form of exercise.
Mhm.
So we do the movement in the right direction, at the right quantity, right frequency, and right intensity. So a good physiotherapist will give you the movement in the right direction, right quantity, right frequency, and right intensity.
Mhm.
That's what makes them feel better, right? So that's what physios, we assess the condition and then we give them the direction on how to move in the right direction and give the right like modality, like maybe heat, cold, and stuff. Whereas when it comes to chiropractic, their goal is to assess. They primarily work on the spine, but they can work on other joints too. So the chiropractor works and helps with the movement specifically. So say if a joint is not moving, they have a quick way of manipulating the joint, and then you get free movement. So physiotherapists, some physiotherapists do manipulate as well, but they need extra training to be able to manipulate a joint. So whereas chiropractors, they're trained to manipulate. So say as you hear the joints, these are called manipulations. So they're
Mhm.
quick thrust manipulations. So
Mhm.
when a movement is jammed in the neck, back, any joints, they can
Mhm.
manipulate to get that movement faster. That's a basic difference between physio and chiropractic.
Mhm. All right, excellent. Now, tell us who can benefit from physiotherapy?
Physiotherapy, we do physiotherapy from head to toe, right? There is like the field has expanded. Beginning in 1940s, 30s, during the Second World War, physiotherapy has evolved from a group of women who were actually nurses, basically. They actually gathered to help the war veterans during the Second World War. So they started helping these amputees and different war, impairments, right? People with disabilities to get better. And slowly the field evolved. So from there, now we treat from head to toe, like maybe headaches, you name it, like Bell's palsy or facial palsy. When it comes to neck whiplash injuries or neck strains, postural issues, people who are sitting in front of the computers a lot, they have text neck syndrome. Shoulder injuries, like when people are playing cricket or any sports, they get injured. Or people who do repetitive tasks, they have shoulder problems. And then when it comes to upper back, postural issues again, upper back pain. When it comes to elbow, you have tennis elbow, golfer's elbow, those are commonly treated. When it comes to wrist, you have carpal tunnel, wrist sprains, strains, fractures are common. When it comes to hands and fingers, there is arthritis that can develop with aging, which we treat. When it comes to low back, there is disc problems, there is low back issues where there is muscle strains when they lift heavy things at work. And when it comes to hips, there is hip arthritis, hip bursitis. When it comes to knee, we treat osteoarthritis in the knee, ligament sprains, sports injuries, ACL, PCL, MCL, different kinds of sports. When it comes to ankle, it's common to roll the ankle and sprain it. We treat sports injuries of the ankle. When it comes to feet, people have heel pain, plantar fasciitis. So if I can name conditions from head to toe. This is more, I talked only about orthopedic, and we do treat pre and post-operative cases before surgeries and after surgeries to get them better and get back to their life. And when it comes to cardiorespiratory, we treat people with lung conditions, breathing problems. So we train them like COVID. We had done a lot of therapy for people to recover from, breathing issues, to get off their ventilator. Physiotherapist role is crucial. And when it comes to neurological, we treat people with paralysis, weaknesses, coordination issues, those ones. And then when it comes to pelvic floor, people with pregnancy and post-pregnancy and issues, we do have women that treat pelvic floor therapy as well. So it's like the field expanded from the beginning where it used to be only for war veterans to where we treat from kids to senior citizens all the way till palliative care, right? So people with cancer, pain, or even in the last stages of their life, to maintain the quality of life, physiotherapists play a crucial role.
Would it be right to say that it's more related to muscular things from head to toe, or no? Is it a wrong perception?
Right. So, like I said, there are different various fields in it. So, what I primarily practice is musculo-skeletal therapy. But, like I said, we do have a neurotherapist who works on paralysis, like neurological conditions. And like my wife, she's a physiotherapist as well. She's a cardiopulmonary physiotherapist. She's not currently practicing it, but there is a field where people post heart surgery or post lung surgeries or people with the breathing problems, there is a field for that. And say there is pediatric physiotherapy where kids with disabilities, they can benefit from pediatric physio. There is geriatric physio where there is old people who are in long-term some nursing homes, they can benefit from geriatric physio. There is pelvic floor physio where people with pelvic floor issues, they can benefit from pelvic floor physio. So there's like umpteen varieties in it. And there is sports physio where specifically they're trained in sports rehab and injuries related to the sports.
Lovely. We love sports, and I have seen many of our friends, they keep sharing when they play, they have those injuries, and I think wonderful they can come to you and see you. Yeah,
absolutely. Yeah, so I'm musculo-skeletal, so any sports injuries I'm able to help.
Lovely. My next question is, if somebody wants to see you, if somebody get injured, so is it important to get the doctor's note before they come to you, referral, or is it possible that they can come and see you directly?
It's a very good question, Naveed. Most times people are hesitant to see a physiotherapist unless a doctor gives the referral. This has evolved again. Now, the physiotherapy field is independent in Canada, meaning a patient can directly see a physiotherapist without a doctor note. However, some insurance companies, in order to cover the physiotherapy service, may require a doctor note. So you got to inquire with your insurance provider in order to make sure that you don't need a doctor note. Right. So just to cover that cost, in order to see me, I don't need a doctor to prescribe physiotherapy to see, but for your insurance purposes, you may need a doctor.
Oh, you may need a doctor, but it's not must that if somebody comes to you first and okay, all right. Now, please share with us, although you have mentioned some of the conditions with which as people they can see you. A little elaborate on what type of condition physiotherapists treat. A little elaboration on that side.
So the common conditions we treat, I gave the whole list. Common conditions we treat are motor vehicle accidents like whiplash injuries. So when a person is in the car and they were hit from behind or side, the neck goes for a jarring motion. Headaches are common conditions we treat as well. And then when it comes to shoulder, we commonly treat rotator cuff conditions. When it comes to elbow, we treat a tennis elbow or golfer's elbow. Those are common conditions. When it comes to wrist, we treat carpal tunnel. That's very common. When it comes to back, we treat sciatica or disc bulges and disc problems. That's very common. I'm also trained to do those low back assessments through, if your doctor refers through the program called Rapid Access Clinic, it's covered through HIP for the back pain. So we do have that provision, and I've been doing that for the past 5 years. And then when it comes to hip, we commonly treat osteoarthritis and bursitis in the hip. When it comes to knee, we commonly treat osteoarthritis in the knee, as well as kneecap issues, patellofemoral issues, and then various ligament injuries like ACL, PCL, MCL. And when it comes to ankle, we commonly treat ankle sprains. When it comes to feet, we commonly treat the plantar fascia at the bottom of the heel. Most people have this heel pain problem. And in our clinic, we do have all providers, all lead healthcare. Like I'm a physiotherapist, my wife is a physiotherapist. We have 3 other physiotherapists, and then we have a chiropractors, actually 2 chiropractors. We have 4 massage therapists, and then we have an acupuncturist. We have a chiropractist who helps with the foot pain. So it's like a one-stop. You can shop everything. So
Excellent.
you don't need to go anywhere else in case of like anything not to do with medication and do a lead healthcare. We have all sorts of help that we can provide for the patient.
Excellent. It seems like advanced physiotherapy is just like a tuk-tuk.ca where people they can find different type of services. Now at advanced physio they can come and they have a variety of services: acupuncture, massage. Am I right? You have massage also, chiropractor also. Excellent. Well, thank you so much, Gowtham, for a lovely session. No, it is almost end, but again, I'd like to request you, please share your contact information so that if somebody wants to see you, they can come to your clinic.
Sure. Thanks, Naveed, for giving me this opportunity. So advanced physiotherapy, you can contact at 905-436-6666. I repeat, 905-436-6666. We are called advanced physiotherapy for a reason. We are all trained with extensive experience, and we have advanced equipment to help your rehab needs. So anything you can think in the industry that is advanced, we do have those equipment, and that's why we are called advanced physiotherapy. I hope you can use our services and get better soon.
Thank you so much, Gowtham, for a lovely session, and thanks for your time. You're a busy person. I hope our viewers will use your services because there are so many services available on your advanced physio, right from physio, massage therapist, chiropractor, acupuncture. So I think it's a wonderful platform. Thank you so much, and let me close the session. Thank you. Thank you, Gowtham.
Thanks, Naveed.